strategies have been focusing on not prevention, but on the symptom. Like all the monies, ideas that have been after the fact, when it has already happened. So I think there is a necessity to revisit all of these strategies so that we can take a root-focused approach to prevent before the problem actually happens. For example, if you look at all of these community problems that we were talking about, like poverty and scarcity of resources, it all affects mainly the mental health. I mean, we have made provision for the physical nourishment, the food. We've made provision for the spiritual nourishment, which is the churches. But there's not enough for the mental health. And the human being is two-dimensional. There's a lot of demand made on the brain, but there is nothing done to be able to actually, nourish the brain or help the brain to recuperate. So I think even the church has to start to, mainstreaming of mental health across the board is very important. This is what we need to be doing. And we can't help long-term sustainability without mental health. Whether it's private sector or whatever sector, it's very important that mental health becomes part of everything that we do. We can't do proper financial management without mental health. Because sometimes, let's assume the child comes from a home where they've suffered a lot, they live in the shacks, and all of a sudden has an opportunity, and then not everybody who is stressed from poverty commits suicide. Even those who are living in abundance also commit suicide because of all unresolved issues that they've brought into the work setting, into the relationship setting, into even governance. Yeah. So I think mental health is something that we really need to prioritize. But also, just the last thing I'm going to say about that is that the first thing also is to debunk the myths and misconceptions about mental health. Because every time we talk mental health, people just think that it means you're crazy. There is so much more to it. Like we are a church. We talk about the network of the human soul. Mind, body, soul, and spirit, like in the form of the Trinity. But we ignore the mind and the spirit, and the mind as though God did not create it. But we've made provision for everything else. But God has, the same God who has given us food for the body and food for the spirit, He's also made provision for mental health. So I think the church has to take a big step in actually, moving. And then we will see less of these statistics of, suicide, even drugs and alcohol. These are just coping mechanisms, So I think mental health deserves another conversation.